Well, I'm Marshall Hoffman with KMRS-KKOK, and we are talking today with Kelsey Peterson from Horizon Public Health. Hi, Kelsey.
Hi, Marshall.
Good to see you again.
Yeah, you as well.
This month, we're going to talk a little bit about some of the um, mostly non-COVID stuff going around this winter season. Although, let's start a little bit with the topical news here about the Omicron virus. I still can't pronounce that right. That's going around, and if you've seen any cases in our area of that.
Yeah, so at this point, we can't confirm that we've seen Omicron in our communities, but it's highly likely. Across the United States, 73% of active cases right now are the Omicron variant.
It's more transmissible than the other variants.
Correct. It's more transmissible. At this point, they can't say that it's more severe than the Delta variant. However, it is more transmissible, meaning that it can spread to more people quickly. Of the cases that they have seen, they've predominantly been younger populations so far, so the severity isn't there, and they seem to manage pretty well. But when it's more transmissible, it means that it's going to, more people are going to contract it, and, ultimately that'll affect how our clinics and hospitals are able to respond.
Still a good idea to get vaccinated and get the booster if you've got your second doses already.
Yes, correct. A lot of what is happening in that they're seeing in the hospitals and ERs is that a lot of people who are needing that higher level of care, the majority are unvaccinated. One thing with the Omicron variant that the data is showing is that people who get boosted or get their booster dose, it is helping prevent them from getting the Omicron variant.
And keeps them away from the hospital too, which is important because, well, as we'll be talking about here in a minute, we've got other diseases, other viruses out there in the community.
Yes. Yep.
So let's talk about some of that. We got first of all RSV. Let's talk a little bit about where we're at with those cases.
Yeah. So with RSV cases across our communities, about a month ago, we seen a surge in cases across our 5 counties and in Stevens County. Most often what happens when RSV presents itself, you are seeing just the common cold symptoms, and that's usually how it starts. You can also see congestion, stuffy nose, you might see some wheezing, and you might see a fever. One thing that people don't always recognize is they often think that RSV is only for children, and that's not always the case. Oftentimes we are seeing it in the elderly population as well. I'll just give some numbers. Actually, back in 2019 to 2020, during that season, across Minnesota, there was 19 RSV-associated deaths, and the average median age was 73 years old, and it ranged anywhere from 11 to 90. So just kind of interesting numbers to know that it does go beyond children.
Would those numbers go down with like last year, like when people were masking more than they were in 2019? Or?
Yes, yep. So a lot of these viral infections that we're talking about today, RSV, influenza, COVID, all of those are transmitted through viral droplets. So anything that you can do to reduce the spread, socially distancing yourself, wearing a mask, those things definitely help and reduce the frequency of it.
I see. That's why I think they wear that on a commonplace basis throughout parts of Asia, which we don't have that in our culture yet.
Right.
Looks like we're not getting there either. But anyway, all right, so that's RSV. Anything else people should know about RSV?
Nope, I don't think that. I think so. I think that pretty much covers it at this point for RSV.
Yeah. If you have symptoms, check with your healthcare provider, as always.
Yeah.
So how are we doing with flu here?
Yeah, so influenza, as we know, is another, it can be spread virally. And so those symptoms, they sometimes mimic COVID. And so what people are doing when they present with symptoms, onset of symptoms for influenza is quicker than COVID. Sometimes COVID symptoms are delayed. But usually it's quick onset with influenza. Usually within 1 to 3 days of infection, you'll notice symptoms. The most common or noticeable symptom that you have first is fever, but then the symptoms continue on from there, and I'll list some of them. So you might experience cough, sore throat, runny or stuffy nose, like I said, fever, chills, headache, fatigue, and you might just feel overall achiness. Sometimes in children, you might notice some additional symptoms. They might have nausea and vomiting, sometimes diarrhea as well.
And you can take the flu shot, always recommended. It's not too late to take that, correct?
Correct. Yeah. So the influenza season in the United States usually starts in October, and actually most oftentimes we see peaks in January and February. And so across the United States, about 58% of the time, cases of influenza peak in February. So although you can start getting vaccinated as early as October, it is still, you are readily available to get the influenza vaccine now, and it will do some really, really good work to help from getting influenza. One thing we are seeing across our counties is that influenza is rising. Getting your flu vaccine will prevent illness by 40 to 60%, and we are seeing rise particularly right now in influenza type A. And so the vaccines that are eligible and that you're available to get right now, 6 months of age and older are eligible for a flu vaccine. We'd encourage you to get that. Like I said, we are seeing a rise in influenza cases, and that, in addition to COVID, is just an obstacle through getting the care you need if you would need to present to the hospital.
How many people die of influenza every year?
Yeah, so I'll get you those numbers actually.
Oh, you're full of charts.
I do have information. Yeah. So back in 2016 to 2017, there was 3,695 hospitalizations. Last 2020 to 21, we only had 35 hospitalizations, and at this point, we're looking at 42 for this flu season already. And so, influenza hospitalizations and deaths have been low these past couple of years, but we are seeing a rise in influenza cases coming on this year. And so it's important to get your flu vaccine because it will prevent, especially those vulnerable populations. You're looking at children, elderly, pregnant moms and postpartum moms who have had babies, and then those with underlying medical conditions. They're at more increased risk for flu complications and hospitalization.
And I understand you can get the flu vaccine the same time you can get your COVID vaccine. It's not like you don't have to wait.
Correct. You can get your COVID vaccine or your booster and your flu vaccine on the same day. The only recommendation is that you get them in separate locations, so separate arms. If you're a child, maybe separate legs. But other than that, no other contraindications to that.
Yeah. All right. And then besides that, what's the other one we should mention? A little bit on tuberculosis, and we were talking about that a little bit before we got on camera here. There's a few cases of that, right?
Yeah, so there are tuberculosis cases across our communities. No active cases at this point, but there are latent cases of tuberculosis that occur. Oftentimes what we're seeing is that they need to access medical care. Oftentimes we don't see it as readily in people who are born in the United States. Oftentimes we see it through immigration. Just the requirements around healthcare needs and immunizations are not the same. So there's different pathogens and viruses and things that they're exposed to. So basically the encouragement is that if somebody has a latent tuberculosis infection, we don't want it to increase to an active infection. So the goal with that is to take medications as prescribed by your provider.
And here you get a TB test or whatever how many years should that be done? Every 10, is it?
It depends on the type of work that you do and the exposure that you have. Often healthcare workers are getting mantos every year. Sometimes, and usually upon any new hire, they're doing that or exposure that they might have. Mantos aren't necessarily a standard practice in all workforces. It kind of just depends on where you're moving to or moving from if you've immigrated. Or the types of exposure you have. Like I said, lots of healthcare workers, school staff, fire departments, things like that, organizations or facilities that you work in, that you could have increased exposure. You should be looking for symptoms.
Okay. Any other viruses that we've missed?
I'd say that those are the ones that we're seeing most of right now, the RSV, influenza on the rise, and then COVID as well.
Which is ever changing. It's like a shapeshifter.
It is.
Yeah.
It really is. Just talking a little bit more about COVID, We're fortunately seeing some of our numbers go down a little bit as far as active cases, which is really nice to see. But our hospitals, the ER admissions, the ICU admissions, the transfers, that's becoming really difficult. And active cases only show a small picture of what's truly happening. We really need to be looking at how many hospitalizations, ICU admissions. I know our hospitals are having an increased struggle, so we have COVID on top of every other normal medical emergency that might come on board: strokes, heart attacks, influenza season, people that are going in for their normal surgeries. So on top of that, we're seeing an escalation in finding placement for people. People are remaining in ERs longer than they need to be to get the level of care that they need due to being unable to transfer them to an appropriate hospital. So it's really encouraged, especially this time of the year with COVID and influenza season being on the rise, to be able to really manage our health and take care of ourselves and the people that are close to us. And if we need to do that by taking care of ourselves, it ultimately opens up our healthcare systems to be able to adequately respond to those who need it when they need it.
Very good. And I should ask you before we go, last question, we are coming up to the holiday season here. A lot of family gatherings. What kind of tips or advice should you give from a health perspective for families gathering this year?
Yeah, so one of the biggest things, of course, is to stay home if you're sick, if you're experiencing any symptoms. I know a lot of people say, oh, it's just a cold that I'm experiencing. Well, it might not be. And to expose your loved ones would be really detrimental, or could be. So making sure that if you have symptoms, you stay home, you alert your family and friends before you come. Another option is to get tested. If you're experiencing symptoms or you think that there might be an exposure, get tested to make sure that you are putting your family in a good situation and making sure that they'll be healthy on the other side. Obviously, you can do your part by getting vaccinated if you haven't done so, as well as getting your booster dose of the COVID vaccine, as well as getting your flu vaccine as well.
Good advice. All right. Kelsey Peterson with Horizon Public Health. Thanks once again for being with us here on KMRS and KKOK.
Thank you.